golden retriever that has a mast cell tumor discovered by the owner on the front of the leg. We can see it right here. Just to give you a little frame of reference as far as the size is concerned. So there's a scalpel. So the mass is probably 3 or 4 centimeters in diameter. The mass is freely mobile, and we can lift it up and get a couple of centimeters underneath it. And so that means that the excision is going to be fairly straightforward. If you haven't already done so, please subscribe to our channel. Make sure that you turn on notifications so you'll get a ding on your phone the next time we live stream. So basically I'm doing 2 centimeter margins in all directions on this thing. The other thing you may notice is that the quality may not be quite as good as it normally is because I've dropped the resolution down to 720p instead of 1080p because we were having trouble with the internet. So I'm recording a very high resolution copy on my hard drive, but I'm not transmitting it right now. And depending on how this looks, I may go ahead and upload the 4K version as well. We'll see how that goes. So just getting my 2 centimeter margins on this mast cell tumor. It was not graded before surgery, but I did discuss with the owners the benefits of grading as far as the ability to better predict the prognosis. The clinical or the assumption is that it's probably going to be a grade 2 just based on appearance, but I really don't have anything to base that on. So we talked about getting a biopsy beforehand, and the owners, kind of on our advice, elected to go ahead and just have it removed because they said basically we don't care what grade it is, we want this thing off, and we're happy to do chemo if we have to or whatever. This dog is insured. So we're going ahead and doing a surgery that would be appropriate regardless of the grade of the tumor. Now we will run in, or could run into, the cephalic vein in here, which we can I think that's it right there, which we can very easily ligate without any problem whatsoever.
Got a question about, can you orientate which body part we are looking at?
Yeah, so this is the elbow. So that moves it out of the field, sorry, but that's the olecranon sitting right back here. This is the interior angle of the elbow joint. That's kind of the pectoral muscle sitting right here. That's cranial, and that's lateral up there. So this is on the cranial aspect of the elbow joint, kind of over the biceps muscle. And making sure that I'm getting my deep margin as well. I've got a couple of centimeters of fat deep to the tumor. Now, if we do get a dirty margin on this, we still have options. My favorite or preferred option would probably be electrochemotherapy of the incision. So we don't have radiation therapy in Melbourne, and so these owners would have to go to Sydney or Brisbane, which is a 9-hour drive or a 20-hour drive. So let's just lay this down like this. All right, so have a better look. Go ahead and hold on to that. So I think that's biceps muscle right there going up into the biceps groove. Okay, can I get some bupivacaine, please? So that's our tumor sample right there. So feels like a clean margin.
What size?
6 ml syringe, please. And then depending on how much tension this is under when I go to close it, I may do a little Z-plasty. So can you guys comment on the quality of the video, if it's acceptable, and also the quality of the sound?
We also got a question asked about, was the original lymph node aspirated?
Yes, so we did a lymph node aspirate on the prescapular lymph node, and while there were a lot of eosinophils present, I did not see any mast cells. So I'm just getting some bupivacaine. All right, so looks like we may have solved the problem with the streaming just by decreasing the quality a little bit. And then again, I have this on my hard drive, and so I'll be able to possibly upload it later on.
People say the quality is good, acceptable, perfect.
So I'm just doing a little splash of bupivacaine. Can I get some OPDS, please? So there is the cephalic vein sitting right there. I don't know if you guys can see that slightly purple or blue hue sitting right there. So to reiterate, if we do get dirty margins on this, we would have the options of either waiting and seeing if it recurs or trying to do something to prevent it from recurring. And the things that we could do to prevent it from recurring would be either to recut, to irradiate it, or to do electrochemotherapy on it. My preference is electrochemotherapy only, well, not only because we don't have radiation therapy, but radiation therapy is not easily accessible here. They have to drive all the way to Sydney. And it requires multiple anesthetic episodes, whereas electrochemotherapy is a single anesthetic episode. And it's been shown to be effective at preventing local recurrence. So the way that I close these to start with is that I just bisect the incision each time. So I did the middle of the incision to start with. Now I'm coming back and dividing each of the two remaining segments and kind of getting that dense connective tissue underneath the skin to reduce the tension at the skin edges. When I drop this leg to decide if I'm doing the Z-plasty, I'll have to reposition my camera. And again, dividing the incision in half. And usually when I do a Z-plasty, I close the incision first to get an idea of how much tension I'm going to have, and then I do the Z-plasty. And this is a fairly high motion area, so we do need to watch out for how much tension we have on the incision. Not a huge amount of tension, but we'll see how it feels when we let the leg down. I think I've taught the vets in Melbourne too well how to do these because I don't get referred these very often anymore. When I first started here in Australia, I used to do a lot of tumors. But I also did a lot of teaching, and so now everybody knows how to do these themselves and they don't have to refer them. I've made myself obsolete. Can I get some 2-OPDS, please? So moderate tension, not too bad. Thank you. So I'm going to do an intradermal here. And I'll lay the leg down and see how much tension it feels like the skin is under. We have to remember that when we do the Z-plasty, if I have any concerns about the completeness of my surgical margins, I need to change my instruments. I do not have any concerns at this point, so I don't feel compelled to change my instruments.
Got a question about, explain please how to use Z-plasty in this area.
So I will show you how to do a Z-plasty as soon as I finish this part of the incision.
And then we got another question about, would you still do an interrupted pattern if it wasn't a high range of motion location?
Good question. So the question is, would I still use an interrupted pattern if it wasn't high tension and high motion? The answer is probably not. I probably would do a simple continuous.
And does it need a drain?
It definitely does not need a drain. We don't have any oozing from the surface, and basically the drain is going to increase the likelihood of infection, so I definitely am not going to use a drain in this setting. A lot of dead space, or if I were doing an accident, but I think drains are vastly overutilized in veterinary medicine. There's no reason to put one in this, certainly not in this setting. Just burying my knot here. So I'm doing an Aberdeen knot. I might do skins on top of this as well, as in I might use a skin stapler. Okay. Go ahead and drop the leg down and I'll reposition the camera. Just like that. Position the lights as well. And change my gloves in case I touch something non-sterile. So apparently the audio is cutting in and out. Maybe it's just that I'm mumbling. Yeah, thanks. Can you guys comment, please, on whether the audio is still bad? So a question about do's and don'ts when doing a tumor excision. Number one is the most important thing is know what you're treating before you treat it. I'll go back to that, hold on. So now what I'm doing is I'm seeing how much tension is in the skin this way and seeing how much tension there is in the skin this way. There's actually almost a little bit more in this direction than there is in this direction. If we were to do a Z-plasty, I haven't decided yet if I am, what you do is you draw one line that's in the direction of the tension, and then you draw a dot to make two equilateral triangles, and then we're going to have one like that and one like that. And then this distance here